The death toll in Malaysia from the COVID-19 pandemic comprises quite a number of those that are past middle age. Thus, there is a misconception that the virus spares the young and healthy from more severe symptoms, including death, if they contract it. But according to respiratory specialist Dr. Kow Ken Siong from Sunway Medical Centre, this is especially untrue. The virus can cause severe lung damage, resulting in multiple organ failure for any age group and further leading to death. COVID-19 patients may first start experiencing fatigue, muscle pain and a dry cough. By day 5, this transitions into breathing difficulties, especially for the elderly or those with pre-existing health conditions.
They can die from lung failure, they can die from heart failure, they can die from septic shock, and they can die from multi-organ failure. Now, when your lung fails, the lung is unable to oxygenate the blood, and this triggers a cascade of problems. So it is this lack of oxygen that causes more inflammation. Your liver dies, your kidney dies, your heart fails, and it is this lack of oxygen that subsequently leads to septic shock and multi-organ failure. Now, if you are elderly and you have chronic illness, you are more vulnerable. But if you are healthier and younger, it doesn't mean that you are spared, as has been reported worldwide.
According to Dr. Kow, patients who are younger and healthier could also develop this. By day 8, the lungs will experience acute respiratory distress syndrome, in which the fluid builds up in the lungs.
At about the same time, the body then recognizes the virus as a foreign invader, and that's when the immune system then sweeps in to remove the virus and also to prevent the virus from making more copies of itself. Now, the end result is pneumonia, where the air sacs in the lungs becomes inflamed and subsequently filled with pus and fluid, and this makes it harder to breathe. Now, we know from reports worldwide that about 80% of patients with COVID-19 infection actually has mild disease. About 20% would require hospitalization, about 14% develops more severe illness, and about 6% becomes critically ill and develop lung failure. We are beginning to get more and more reports of younger and healthier patients who are running into trouble as we see an increase in the number of infections daily worldwide.
The World Health Organization has also warned younger people against complacency, as a number of research has proven that COVID-19 can result in severe disease among persons of all ages.